Adalimumab is a medication used to reduce pain and swelling caused by certain types of arthritis and to treat certain skin disorders. It works by blocking a protein in the body's immune system that causes joint swelling and damage in arthritis, as well as red scaly patches in psoriasis. This medication belongs to a class of drugs known as TNF blockers. By reducing joint swelling, adalimumab helps to reduce further joint damage and preserve joint function. Additionally, adalimumab is also used to treat certain bowel conditions such as Crohn's disease and ulcerative colitis, as well as a certain eye disease called uveitis. It is available in various forms under different names, such as adalimumab-aacf, adalimumab-Adbm, and adalimumab-afzb. It is important to take adalimumab as prescribed by your doctor, and to discuss the best time to take it for your specific condition. Before starting to use adalimumab, it's important to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for clarification. If you are using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional and the product package. Before using, make sure to visually check the product for particles or discoloration. If either is present, do not use the liquid. Also, if you are removing this medication from the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication any other way, such as by heating in the microwave or placing in hot water. Before injecting each dose, remember to clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed by your doctor. Inject this medication under the skin on the thigh or abdomen as directed by your doctor, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule/higher dose at the start of your treatment. Carefully follow your doctor's directions for using this medication. It's also important to learn how to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it, and mark the day on the calendar when you need to receive this medication to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed. If your condition lasts or gets worse, make sure to inform your doctor. If you experience redness, itching, pain, or swelling at the injection site, it's important to tell your doctor or pharmacist. This medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. It's important to tell your doctor right away if you develop signs of infection while using this drug, as well as any serious side effects. Adalimumab may rarely cause serious liver disease, so it's important to watch for symptoms during treatment and for several months after your last treatment. If you notice any symptoms of a serious allergic reaction, it's important to get medical help right away. And as always, if you notice any other effects not listed here, be sure to contact your doctor or pharmacist. Adalimumab can lower your body's ability to fight infections, which can lead to serious infections like fungal or bacterial infections, including tuberculosis. Be sure to inform your doctor about any past, recent, or current infections, as well as any travel to areas where certain fungal infections are common. Your doctor will test you for tuberculosis before and during treatment, and if diagnosed, they will provide treatment to prevent a serious TB infection while using adalimumab. There is a slight risk of developing cancer, especially in children, teens, and young adults, due to this medication or your medical condition. It's important to discuss the risks and benefits of treatment with your doctor, and to inform them if you experience symptoms such as a persistent fever, unusual lumps or growths, swollen glands, unexplained weight loss, or night sweats. Before starting adalimumab, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. Also, be sure to discuss your medical history, especially if you have had infections, blood or bone marrow problems, seizures, cancer, heart disease, or other health conditions. It's important to be cautious around people who have infections, as adalimumab may increase your risk of getting sick or worsen current infections. Avoid contact with anyone who has a contagious illness, and talk to your doctor if you have been exposed to an infection. Before getting any vaccinations, let your healthcare professional know that you are using adalimumab and avoid contact with anyone who has recently had a live vaccine. Be careful with sharp objects and avoid activities that could result in cuts or injuries. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications you are using. Older adults may be more susceptible to infections and cancer while taking adalimumab. If you are pregnant, talk to your doctor about the risks and benefits of using this medication. Adalimumab can pass into breast milk, so be sure to consult your doctor before breastfeeding. It's important to be aware that this medication may interact with other drugs, which could affect how they work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with this drug include other TNF blockers, such as etanercept and infliximab, as well as other drugs that weaken the immune system, like abatacept and anakinra. Always be cautious and check with your healthcare provider before taking any new medications alongside adalimumab-Adbm, CF, pen Crohn's UCHS starter 40 mg per 0.8 ml subcut kit inflammatory bowel agents. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. You can call 911 or your local poison control center right away for assistance. In the U.S., you can reach the Poison Control Center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. It's important not to share this medication with others. Your doctor may also recommend lab and/or medical tests, such as a complete blood count and liver function tests, while you are using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, it's important to consult with your doctor or pharmacist to plan a new dosing schedule. Do not take a double dose to make up for the missed one. It is important to store this medication in the refrigerator, but do not freeze it. Some brands may be stored at room temperature, so it's best to check with your pharmacist or read the product package for specific instructions. Once the medication has been stored at room temperature, it should not be returned to the refrigerator. Keep the medication in the original container to protect it from light, and make sure to discard any unused portion. Remember to keep all medications away from children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the medication when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.